Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Okay, question number first. The bone which is part of axial skeleton is options A femur, options B tibia, option C sacrum, options D humerus. The right answer is option C, that is sacrum. The bone which is part of axial skeletons among all options, that is sacrum. Okay, axial skeletons mainly comprise of that bone which is distributed along that main central axis of the body, for example head, vertebral column, mainly including tail and ribs and as well as sternums. Okay, while appendicular skeletons comprise of bone which is located away from the central axis of the body, for example bone of the limb, that is including both forelimbs and hind limbs and including scapula, and os coccyx, which is hip bone. Okay. Questions number second. The number of thoracic spinal nerves presents in the cattle is options A 7 pair, options B 13 pair, option C 18 pair, options D 37 pair. The right answer is options B, that is 13 pair. Okay, let's see the division of spinal cord and that spinal nerves. Then we found that spinal cord is divided into that five part, that is a cervical spinal cord from where that cervical spinal nerves emerges, thoracic spinal cord from where thoracic spinal nerves emerges, lumbar spinal cord from where lumbar spinal nerves emerges, and sacral spinal cord from where sacral spinal nerves or emerges, and coaxial spinal cord from that coaxial spinal nerves emerges. Okay, all these spinal nerves are paired and passes through intervertebral foramina of vertebral column. And number of that spinal nerves in case of dog, that is a 35 to 36 pair. Number of spinal nerves in case of cat, that is 31 pair. Number of spinal nerves in horse, that is 44 pairs. Number of spinal nerves in cattle, that is 36 pair. Number of spinal nerves in pig, that is 39 pair. In case of bird, that is 30 to 33 pair. Okay, and if we see that branches of the spinal nerves, we found that spinal nerves are of having two branches, that is a dorsal branch and there's a ventral branch. And the dorsal branch actually supply to that muscles and muscles around vertebral column and that skin, while ventral branch which is mainly supplied to that muscles and skin which is ventral to that transverse process of that vertebral column, and is also supplied to that forelimbs and hind limbs through that forming brachial plexus and lumbosacral plexus. Okay, brachial plexus is formed by anastomosis of ventral branches of last three cervical and first one, that is a ventral branch of thoracic spinal nerves. Okay, in case of goat and sheep, while in case of cattle, horse and dog, that brachial plexus is formed by the anastomosis of ventral branch of last three cervical and first and second that ventral branch of thoracic spinal nerves. Okay, and that supply all the structures of that forelimbs and also that lateral wall of that the thorax and also abdomen of animal. And if we see that branches of that brachial plexus, it mainly include 10 nerves. That is suprascapular nerves, subscapular nerves, and musculocutaneous nerves, pectoral nerves, axillary nerves, radial nerves, median and ulnar nerves, thoracodorsal nerve, long thoracic nerve, lateral thoracic nerve, extra. And if we see that lumbosacral plexus, it is also formed by the anastomosis of that the last three lumbar ventral branches of spinal nerves and first two sacral nerves, which is supplied to that blood to that hind limbs, and it's mainly consists of 8 nerves, that is cranial and caudal gluteal nerves, caudal cutaneous femoral nerves, pudendal nerves, caudal rectal nerves, sciatic nerve, tibial nerves, and fibular nerves. Okay, questions number 3. The example of elongated bone is options A rib, options B scapula, option C radius, options D atlas. The right answer is options A, that is ribs. Okay, ribs is an example of that elongated bone, and if we see that's classification of a bone on the basis of their shape, that we found as a long bone, long hollow cylindrical type bone. This is weight bearing bones, and it is mainly found in the long bone is mainly found in case of limbs, that is hind limbs and forelimbs. An example of that long bones is that femurs and humerus. And if we see that short bone, that's carpal, metacarpal, and then tarsals, metatarsals are the example of short bones. Flat bones, that is scapula, and some that cranial bone, which mainly protect the brain, the example of that flat bone. Vertebra is an example of irregular bone, and that humerus of fowl is an example of that pneumatic bone. and not weight bearing a small seed like bone, that is a sesamoid's bone. That patella is example of sesamoid's bone. And visceral bone are those bone which are found in the viscera of some animal. For example, os penis in case of dog, os cardis, which is found in heart in case of a ruminant, os opticus, which is mainly found in eye of that fowl, and os phrenic, which is found in diaphragm of camel. These are the example of a visceral bone. Okay. Questions number 4. A pulley-like structure which is seen on the bone is termed as option C trochanter, options B trochlea, option C spine, options D condyle. The right answer is options B, that is a trochlea. Okay, the pulley-like structure which is seen on bone, that is a trochlea. Let's see some terminology which is related to that veterinary anatomy. Then spine is elongated. That elevations which is found on that bone surface, while that elongated depressions on a bone surface, that is known as a sulci, and the prominence on that bone, that is known as a process, and a small flat undulating articular surface, that is known as a facets. And when there's a depression on a bone surface, that is known as fossa. Pulley like articular surface, that is known as trochlea. Knuckle shaped pair articular surface, that is known as condyle, and small non-articular projections, that is along condyle, which is known as epicondyles. Very small pitted articular surface, that is known as fovea, and curved horn like process, that is known as cornu. Hook like process, that is known as hamulus, and a large round projection, that is known as tuberosity. Small projection, that is known as tubercles. Very large prominence, that is known as trochanters. When there is a faint elongated elevation, that is known as line. Small projection, that is known as tubercles. Sharp crest elevation, that is known as sharp rough elevation, that is known as crest. Okay. And bony projections which is of nodular shape, that is known as protuberance. Okay. Perforation in a bone for passage of vessels, that is known as foramen. Fissures in a bone, that is known as cleft. And thin plate like structure, that is known as lamina. And convex articular surface, that is known as caput or head. Okay. Questions number 5. Collar bone of the soldier is options A scapula, options B clavicle, option C coracoid, options D ribs. The right answer is options B, that is a clavicle. Clavicle is known as that soldier. That clavicle is known as that is a that collar bone, and clavicle is actually S-shaped long bone. And pectoral girdle or soldier girdle, if we see that it is has consist of 3 types of bone, that is a first is scapula, clavicle, and coracoid. Okay. And if we see that's major structures which is present in scapula, then we found there's a acromion process, we found there's a coracoid process, and we found there's a glenoid notch. And this acromion process absent in case of a horse, coracoid process absent in case of a dog, and this and then acromion process is rudimentary, and glenoid notch absence in case of a pig. Meta-acromion process is present in case of a rabbit. And if we see that's fowl, the 2 clavicle bone get fused, and that is known as a forcula. And this is also known as a wishbone in case of fowl. Okay. Questions number 6. The NAV nomenclature of soldier girdle is options A pectoral girdle, options B thoracic girdle, option C cingulum membri thoraci, or options D extremitas thoracalis. The right answer is option C, that is a cingulum membri thoraci. The NAV stands for Nomina Anatomica Veterinaria, is a standardized nomenclature made by a World Association of Veterinary Anatomist. Okay, na? And the following principles should be applied while giving the name according to this NAV rule. First is that aside from a very limited number of exceptions, each anatomical concept should be designed by a single term. Okay. Each term should be in that Latin in that official list, but the anatomists of each country are free to translate the official Latin term into the language of their instructions. Okay. Structures that are closely related topographically have the similar name, should have similar name. For example, like arteria femuralis, vena femuralis, nervus femuralis. These all are related to that. The structures related to that femur. Differentiative adjectives should generally be opposite as majors and minor, superficialis and profundus. Okay. A term derived from that proper name should not be used. Okay. Questions number 7. The bone of the arm region is options A humerus, options B radius, option C carpal, options D metacarpal. The right answer is options A, that is a humerus. Okay. Humerus is the bone of arm region. Okay. Humerus is actually the long bone which is situated obliquely downward and backward. and it's formed shoulder joint with its scapula, and it's formed that the elbow joints with the radius and ulna. And the humerus mainly consists that cylindrical shaft which is twisted, and it's mainly contain four surface, that is anterior surface, posterior surface, medial surface, and lateral surface. And if we see that's major structures which is found in humerus, then we found there's a teres tubercle. At the middle of that medial surface, there is a tubercle, which is mainly for insertions of teres majors and latissimus dorsi muscles. Okay, this is a teres tubercles. Second structure we found on that humerus, that is a deltoid tuberosity. Between the anterior and then the lateral surface, there is a border which is known as that crest of humerus, and at the middle of that this crest of that humerus, there is a prominence for the insertion of that deltoid muscles, that is known as deltoid tuberosity. Okay, while nutrient foramina is located at the distal third of the posterior surface. Okay, and bicipital groups, which is located at the proximal end of the humerus, and radial fossa and olecranon fossa, olecranon process, these are located in that the distal end of that humerus. Okay, and let's see that the different characters in different species. Just like that prominent deltoid tuberosity found in case of humerus of a horse, and there's a supratrochlear foramina which is present in radian, and which is present in that dog and pig, and this supratrochlear foramina that communicate that radial and that olecranon fossa. Okay, and while that humerus is pneumatic in nature, in case of fowl, that is that bone marrow is replaced by mean of there's air. Okay, questions number 8. The number of the functional digits in cattle is options A 1, options B 2, options 3, options C 3, options D 4. The right answer is options B, that is 2. Okay, digits are mainly composed of that first phalanx, second phalanx, and third phalanx. In case of ruminant like sheep, cattle, and goat, there are actually 4 digits, which is naming as a second, third, fourth, and fifth, out of which third and fourth are well developed, while fifth and second are rudimentary, and mainly presented by as a small dew claw which is located at the back of the fetlock joint. While in case of that but in case of like if we talk about that the digits of that digits of digits of that hind limbs, then in case of that ox, there's a first and fifth metatarsals are absent, and the third fourth third fourth is metatarsals well developed, and that bearing digits, while second one just a quadrilateral plate like. Okay, in case of horse, there's a first and fifth are absent, third well developed carry digits, and second and fourth much reduced. In case of pig, that first is absence, third and fourth well developed carrying digits, second and fifth are somewhat reduced and also carry accessory digits. In fowl, that 4 metatarsals are present. First one is small, and second, third, and fourth that elongated and carry chief digits. Okay. Questions number 9. The lateral surface face of the scapula give attachment to lateral surface face. Options A, deltoideus muscles. Options B, serratus ventralis. Option C, rhomboideus. Options D, subscapularis. The right answer is options A, that is a deltoideus. Okay, scapula lateral surface give attachment to that deltoideus muscles. If we see that scapula is flat triangular shaped bone which is situated at the craniolateral aspect of the thorax, and it is directed downward and forward directions. It is mainly extend from third to fourth thoracic spine to the distal end of the first ribs, and it possesses mainly two surface, and there is a that is lateral surface and medial surface, and there's a 3 angle and 3 border. If we see that the lateral surface of the scapula, it is divided into two unequal parts, that is supraspinatus fossa and that infraspinatus fossa by an spine. Okay, supraspinatus fossa accommodates supraspinatus muscles, whilst inferior one is accommodate that infraspinous muscles. Okay, and this spine is broad and bend backward at middle to attach trapezius muscles, and this spine terminate below into a pointed projections, and pointed projection that is known as acromion process, where deltoid muscles originates. Okay, if we see that medial surface, there is a shallow fossa at the middle, that is called a subscapular fossa, which accommodates subscapular muscles. On the upper part of this surface, there is a cranially and caudally. There are two rough triangular area for that attachment of that serratus cervicis and serratus thoracis muscles respectively. Note there is a biceps brachii muscles which originates from tuber scapulae or supraglenoid tubercles, which is situated at cranial aspect of a glenoid cavity, while coracobrachialis muscles, which is originates from coracoid's process. Okay. Questions number 10. Distal extremity of femur consists of options A, head, options B, tubercle, option C, trochlea, options D, tuberosity. The right answer is options C, that is trochlea. Okay, let's see that femur is actually cylindrical and the largest long bone. It is mainly directed obliquely downward and forward directions. Okay, and it's articulate with that hip bone above to form that hip joints, and it's articulate with the tibia and fibula and patella, and forming that stifle joints or knee joints. It has a femur has a body and there's a two end. Okay, the body is cylindrical in middle and have a three while having three sides in below and above. Okay, and if we see that's a lateral, medial and anterior surface of the that femur, these are smooth and continuous and mainly covered by quadriceps muscles, while the medial surface is not so that smooth. Let's see some special structure which is present in femur, that is a lesser trochanter, which is situated at the upper part of the medial border of the posterior surface. Uh, uh, Posterior surface, there's a rough depressions in trochanter for that iliacus and psoas majors muscles. Okay, and distally to this medial border, there is a rough prominence also, medial supracondyle crest. From this medial head of gastrocnemius muscles originates. Okay, there is another structure is fovea capitis femoris. There is a small depression at the head of the femur. Another structure is greater trochanter, which is a large tuberosity situated at a lateral aspect of anterior end. Okay, trochanteric ridge, which mainly connect that greater and the lesser trochanter. Trochanteric fossa, which is an enclosed depressions between trochanteric ridge and head. Okay, and if we see that distal end of that distal end of that the femur, we found that condyle and trochlea. So in that proximal end, we found major structures like lesser trochanter and that greater trochanter, and that is a trochanteric ridge, trochanteric fossa, and we found there's a fovea capitis, and we found there is a supracondylate crest. Okay, while in case of distal end we found condyle and trochlea. Okay, let's see some fact related to that trochlea. That's a third trochanter, which is an extra prominence, which is located in upper part of the lateral border, presence in horse. Okay, and supracondylate fossa, which is absent in case of a dog, and only greater trochanter is present in case of fowl. Questions number 11. The number of a carpal bone presents in dog in each limb. Options A 4, options B 5, option 6, option C 6, option 7 D. Option D 7. The right answer is options D, that is 7. Number of a carpal bone which is present in dog, that is 7. Okay, this carpal are the short bone which is arranged in actually in that two row, that is proximal row and the distal row, and it is located between that radius ulna above and then metacarpal bone in below. In case of a cattle, the carpal number is the total carpal number is that is 6. Okay, while proximal row contain 4 carpal number, while distal row contain 2 carpal number. Proximal row includes radial, that is known as a scaphoid, intermediate semilunar, ulnar, cuneiform, and accessory, that is pisiform carpal bone. While distal row includes that second and third fused, which is known as os magnum, and fourth unciform, that carpal bone. In case of a horse, the total number of carpal bone is 7, and also in case of dog, the total number of carpal bone is 7. Where the in case of where in horse, the proximal row contain 4 carpal bone, which include radial, intermediate, ulnar, and accessory, while distal row includes that 3 carpal bone, that is second, third, and fifth, second, third, and fourth. First carpal is in the form of a small nodules in case of horse. Okay, in dog, that proximal row contain 3 bone, that is radial, intermediate, there is a fused, and ulnar and accessory, while distal row include 4 carpal bone, which is first, second, third, and fourth. In pig, there is a 8. Proximal row include radial, intermediate, ulnar, and accessory. Distal include first, second, third, fourth. Okay. In rabbit, there is also 8. Proximal include radial, intermediate, and ulnar. Okay. While distal include that fifth, 1, 2, 3, fourth, fifth. Okay. In fowl, there is a 2. Proximal include radial and ulnar carpal, while distal row fused with that metacarpal. Okay. Questions number 12. The pin bone is options A, ilium, options B, ischium, option C, pubis, options D, sacrum. The right answer is options B, that is ischium. Pelvic girdle or bony pelvis is formed by actually that right and left hip bone, which is known as oxcoccyx, and some sacrum, which is that vertebrae, and one or two that coaxial vertebra. Each hip bone is mainly consist of a three bone, that is ilium, ischium, and pubis. Okay, and these bones are joined together to form a large acetabular cavity which articulate with the head of the femur, and hip bone of one side is joined to that other hip bone on the other sides at pelvic symphysis. Okay, and if we see that's ilium, ilium is that triangular shaped flat bone which is situated at craniolateral aspect of a pelvis. And if ilium has two surface, that is a gluteal surface and there's a pelvic surface, and ilium has three angle, that is external angle which is known as tubercocci, internal angle which is known as tuber sacrali, and distal cotyloid angle which is expanded and joined with the corresponding angle of the pubis and ischium to form cotyloid cavity, that is known as acetabulum, and which articulate with that head of the femur. While ischium is that quadrilateral plate which is situated that behind the pubis, and it's form most part of the pelvic floor, and having ischium has two surface, that is a pelvic surface and there's a dorsal surface, um, and there's a four border, pelvic surface, and there's a ventral surface. Okay, and there's a four border which is anterior border which form that the posterior border of obturator foramen, and there is a posterior border which actually meet with that posterior border of other ischium's bone and form ischial arch, and there's a medial border which also meet with that medial border of that other ischium's bone and form ischial symphysis, and ventrally and there is a uh, lateral border. Okay na? And there's a four angle, that is an anterior internal angle. Anterior external angle is known as that form that cotyloid cavity. Okay, posterior internal angle and posterior external angle, while posterior external angle form that trifid ischial tuberosity referred as pin bone. Okay, while if we see that pubis is also that triangular shape, is mainly contain two surface, that is dorsal or that pelvic surface, and then ventral surface, and also it contain three borders, and there's a three angle. Questions number 13. The patella is seen in dog in the options A, shoulder joint, options B, stifle joint, option C, carpal joint, options D, hock joint. The right answer is options B, that is stifle joint. Okay, the patella is seen in dog in the stifle joints. If we see there's the type of joint, then we found there's an immobile or synarthrosis or fibrous joints, which is that the joints which is present in that the that cranium, that is known as a suture in skull. Okay, and while second is that slightly movable and amphiarthrosis and cartilaginous joint, example like intervertebral disc joints, ribs, and that pelvic joints. Okay, and last is that freely movable diarthrosis synovial joints, for example ball and socket, which we seen in case of like a hips and shoulder, and then hinge joint, which is a knee and elbow joints, pivot, that is base of the head at neck, and then saddle, which is base of the finger. Okay, ipsiloids or condyloid, that is wrist or wrist joints, and gliding, that is metatarsals and phalanges, that is gliding joints. Okay, and if we see that different types of joint which is present in four limbs, that is shoulder joints, which is joint which is present in scapula and humerus, and there is a elbow joints which is located between humerus and radius and ulba, and there's a carpal wrist joint which is located between that carpal, metacarpal, and radius and ulna, and there is a phalanges, metacarpal, and first phalanx, that is known as fetlock joint, first phalanx and second phalanx, that is known as piston joint, second phalanx and third phalanx, that is known as coffin joint. Okay, and if we see the different types of joints in that hind limbs, we found there's a hip joint, which is a joint between that pelvic girdle and femur, Then there's a stifle and knee joint, which is the joint between femur and tibia and fibula. And there is another is that the hock joint, which is also known as ankle joint, that is joint between tibia, fibula, tarsus and metatarsus. Then we found there's a fetlock joint, that is metatarsus and first phalanx, and there's a first phalanx and second, there is coffin, and second phalanx and third, there is a second phalanx and third, there's a coffin, and first phalanx and second, there's a pastern. Okay. Questions number 14. The typical cervical vertebra is options A first, options B third, option C sixth, options D seventh. The right answer is options B, that is third. Example of typical cervical vertebra, that is third cervical vertebra. A typical cervical vertebra has a falling part like body, arc, and then process. Okay, there's a process like supraspinous process, transverse process, and cranial caudal articular process. A typical cervical vertebra, which does not have that same type of that body part. That's our first, second, and sixth and seventh. Let's see the vertebral formula of different domestic animal. Then we found that the in case of cattle, horse, dog, pig, that cervical vertebra is that 7 in number, while in case of fowl it is 14 in number. If we see that thoracic vertebra, that is a 13 in case of a cattle and dog, while 18 in case of horse, and 7 in case of fowl, and pig 14 to 15. While if we see that lumbar vertebra, then we found there's a lumbar vertebra is 6 in case of cattle and horse, and 7 in case of dog, and 6 to 7, that's pig, and fowl in case of fowl, there's a lumbar and sacral vertebra get fused, that's 14 in number. While sacrum, that is a in case of a cattle and horse, that is 5 in number. In case of dog, that is 3 in number, and pig in case of 4 in number. Okay. While coxal vertebra, that's 15 to 25 in case of cattle, 16 to 22 in case of horse, 18 to 25 in case of dog, 18 to 24 in case of pig, and 4 to 9 in case of fowl. Okay. Questions number 15. Haemal arches are present in the coxal vertebra of options A, jog, options B, ox, options C, that is horse, options D, that is fowl. The right answer is options A, that is dog. Haemal arc are present in the coxal vertebra of dog. Okay. Haemal arc, which is also known as a chevron, is a bony arc which is located on a ventral side of a tail vertebra of vertebrates. Okay, it's provide protections for that median coccygeal artery, and it's which includes by arc. Okay, and if we see that other structures which is present in case of a vertebra, then there's a fovea dentis, which is the depressions which is located at the caudal part of the floor of the atlas. Okay, and articulate with odontoid process of axis, while fossa atlantis, which is the ventral surface of wing of atlas, which is convex, and term as fossa atlantis. Okay. Questions number 16. The number of a pair sternal ribs presents in the dog is options A 7, options B 9, options C 13, options D 18. The right answer is options B, that is 9 pair. Okay, number of a pair of sternal ribs presents in dog, that is 9 pair. Okay, if you see that ribs is a curved, elongated bone which arranged one after another from either of that vertebral columns and form the thoracic cage. A typical rib has a that falling part like head at the proximal end, shaft, and there's a costal cartilage at the distal end. Okay, now there are 3 types of ribs we form. That's sternal or true ribs. Ribs which is directly connected to the sternums by mean of there is own costal cartilage. Second is asternal or false ribs, which join the sternum through costal cartilage that connect to preceding costal cartilage. Okay, and third is that floating ribs, which either single or in pair, which is located at the end of the series and which are not connected with sternum directly or indirectly. Okay, and if we see that's in cattle, that 13 pair of ribs are presents, out of which first 8 pairs are sternal and rest 5 pairs are asternal. Horse, that is 18 pair of ribs, out of which first 8 are sternal and the rest 10 are asternal. Dog, 13 pair of ribs, out of which first 9 pairs are sternals and 4 are asternal. In pig, 14 to 15 pair of ribs, out of which first 7 are sternal and rest 7 to 8 pairs are asternals. While last ribs is small and floating, first ribs has a prismatic body. In case of fowl, 7 pair of ribs are present. Okay, note that unseen process are present in ribs of fowl. Okay, questions number 17. The foramen magnum is present in option C, occipital bone, options B, parietal bone, option C, temporal bone, options D, frontal bone. The right answer is options A, that is occipital bone. Foramen magnum is present in occipital bone. If we see that skull is composed of a head, and skull is the skeletons of the head, and is mainly composed of two parts. That is a bone, a cranium bone, and then facial bone. The cranium bone which mainly protect the brain, and that facial bone, the bone which is located on facial regions. Okay. If we see that the cranium bone, then we found that occipital, sphenoids, ethmoids, which is a single bone, and we found that the interparietal, parietal, frontal, and temporal, which is a paired bone. We also found that the facial bone like lacrimal, malar, maxilla, premaxilla, palatine, nasals, pterygoids, turbinate, which is a paired, and vomer is a single bone. Okay. Foramen magnum, paramastoids process, condyloid fossa, condyloid foramen, hypoglossal foramen, mastoid foramen, external occipital protuberance. These are the structure which is found in occipital bone. Pituitary fossa, that's sella turcica, foramen ovale, foramen orbito optic foramen. These are the structures which is found in sphenoids bone. Cribiform plate found in that ethmoids bone. Lacrimal fossa found in lacrimal bone. Zygomatic process or frontal process found in malar bone. Infraorbital foramen found in maxilla, while supraorbital foramen found in frontal bone. Okay. Uh, Largest sinus which is present in horse, that is maxillary sinus. Okay. Questions number 18. The muscles present in the medial aspect of the thigh region is options A, gluteus medius, options B, semitendinosus, option C, biceps femoris, options D, sartorius. The right answer is options D, that is sartorius. Okay. Muscles which presents in medial aspect of thigh region, that is sartorius. Okay, let's see some muscles which is present in a thigh region. Muscles presents on a lateral aspect of thigh region, that is tensor fasciolata, superficial gluteus, middle gluteus, deep gluteus, biceps femoris, and semitendinosus. At the rate, that is GBST, which is G stand for gluteus, B for biceps femoris, S for that semitendinosus, and T for tensor fasciolata. Okay. Muscles which is present on a medial aspect of thigh, that is sartorius, gracialis, pectineus, adductor, and semimembranous, quadratus femoris, obturator internus, obturator externus, gemellus. Muscles of anterior aspect of the thigh, that is a quadriceps femoris, and articular genu. Muscles of anterior lateral aspect of thigh, that is complex, which is includes peroneus, tertius, medial digital extensor, common digital extensor, lateral digital extensors, peroneus longus, tibialis, anticus, extensors brevis. Muscles of posterior medial aspect of thigh, that is a gastrocnemius, nisoleus, superficial and deep digital flexors, and popliteus. Okay. Questions number 19. Prepubic tendon is the insertion of which muscles? Options A, cremaster muscles. Options B, rectus abdominis. Option C, abdominis internus. Options D, transverse abdominis. The right answer is options B, which is a rectus abdominis. Okay. Prepubic tendon is the insertion muscle of rectus abdominis muscles. Muscles of abdomen, let's see. There's a four types of muscles: obliquus abdominis externus, obliquus abdominis internus, transverse abdominis, and rectus abdominis. If we see that obliquus abdominis externus, these are extensive muscles of lateral abdominal wall. Its fibers are directed downward and backward. If we see that obliquus abdominis internus, it's located below that externus muscles, and its fiber are directed forward and downward. If we see that transverse abdominis, it's the inner muscles, its fiber are directed transversely downward. If we see rectus abdominis, it's elongated flat muscles extend from sternum to that pubis along floor of that abdominal cavity. The origin of that abdominis, obliquus abdominis externus muscles, that is the lateral surface of that ribs from the fifth intercostal space and lumbodorsal fascia, and it's insert in the lineal-albine prepubic tendon. In case of obliquus abdominis internus, this muscle's origin from tubercocci or Paupart's ligaments and lumbodorsal fascia, and it's insert at lineal-albine prepubic tendon, few ribs and cartilage. Transverse abdominis muscles origin at a transverse process of lumbar vertebra and some sternal cartilage, and it's insert at linear-albine xiphoid cartilage, while rectus abdominis muscles origin at lateral and ventral surface of sternum, and it's insert at pubic and linea alba. Okay. Note that cremaster's muscles is the muscles which covers testicles, originates from pubic tubercles and insert into tunica vaginala. Questions number 20. The thorax muscles is option A, serratus cervicis, options B, retractor costae, option C, scalenus, option D, longus coli. The right answer is the thorax muscles is, the right answer is retractor costae. Muscles of back, thorax, and sublumbar regions, that is longissimus dorsi, multifidus dorsi, intercostal, rectus thoracis, serratus thoracis, iliacus, longissimus costarum, levator costarum, serratus dorsalis, anticus, internal intercostals, transversus thoracis, zoes major, zoes minor, quadratus lumborum, intertransversals lumborum, latissimus dorsi, retractor costarums, serratus dorsalis, posticus externus, extra. Questions number 21. The muscles is not part of mastications. Options A, masseter. Options B, temporalis. Option C, malaris. Options D, digastricus. The right answer is option C, that is a malaris. Okay. Malaris is not mastications muscles. Muscles of mastications mainly include masseter, lateral pterygoids, temporal, digastric, mylohyoids, temporalis, medial pterygoids, extra. Okay. Questions number 22. The muscles of the hyoidus apparatus is option C, styloglossus, options B, mylohyoideus, option C, hypoglossus, options D, palatinus. The right answer is options B, that is a mylohyoideus. Okay, muscles of the hyoid apparatus includes that mylohyoideus, geniohyoideus, sternohyoideus, thyroides. Muscles of the tongue may include genioglossus, hypoglossus, styloglossus. Muscles of the soft palate and pharynx include palatinus, tensors veli palatini, levator veli palatine, extra. Questions of the 23. The extrinsic muscles of the larynx is options A, cricothyroideus, options B, cricoarytenoideus, option C, thyroarytenoideus, options D, sternothyrohyoideus. The right answer is options that is a D, that is sternothyrohyoideus. The muscles of larynx are actually divided into two groups, that is extrinsic muscles and intrinsic muscles. This extrinsic muscles, which are mainly responsible for the productions of a movement of the hyoids bone. Okay, na? These are infrahyoids like sternohyoids, omohyoids, sternothyroids, thyrohyoids, and suprahyoids, that is stylohyoids, digastrics, mylohyoids, geniohyoids, extra. Okay, and next is intrinsic muscles, which is responsible for the movement of that vocal cord in order to produce that speech sounds. Okay, they are adductor, like lateral cricoarytenoids, transverse arytenoids, abductor like posterior cricoarytenoids, sphincter, that is transverse arytenoids, oblique arytenoids, aryepiglottic. Muscles that tense the vocal cord and muscles that relax the vocal cord is mainly thyroarytenoids vocalis. Questions number 24. Subsynovial groups seen on which surface of the heart? Options A, left. Options B, right. Options C, anterior. Options D, posterior. The right answer is options B, that is right. Subsynovial groups seen on right surface of the heart. Let's see some surface and border of the heart. Then we found that there is a 5 surface and 5 borders of the heart. Okay, 5 border of the heart we can learn by the mnemonics like rails, that is a right border, which is formed by right atrium, apex border which is formed by left ventricles. Okay, na? And there's an inferior border which is formed by right ventricle and right ventricle and right and left ventricle, and there's a left border which is formed by left atrium and left ventricle, and there's a superior border which is formed by right atrium and left atrium. Okay, and there's a 5 surface of heart. Mnemonics is apparel. Okay, anterior surface which is formed by right auricles and ventricles and left auricles and ventricles. Okay, there's a posterior surface which is formed by right atrium and right ventricle, and there's a right surface which is formed by right atrium. There's an inferior surface which is formed by which is also known as diaphragmatic surface, formed by left and right ventricle. Okay, na? And there's a left surface which is formed by left atrium and ventricles. Okay, on the surface of heart there are series of groups which is also known as sulci. Each sulci contain coronary blood vessels and variable amount of fat. Sulci mark the external boundaries between two chambers of the heart. Coronary sulcus or atrioventricular sulcus mark the external boundary between that artery and ventricles. Interventricular sulci marks the boundary between the right and left ventricles. Okay, anterior interventricular sulci which is located on the anterior surface, posterior interventricular sulci which is located on that posterior surface. Okay, questions number 25. The coronary sinus presents in options A, right atrium, options B, left atrium, option C, right ventricle, options D, left ventricle. The right answer is options A, that's the right atrium. Okay, the coronary sinus presents in right atrium. It's actually bring deoxygenated blood from heart, okay. Two coronary artery, that is the right and left, arises from that aorta, which is applied to the oxygenated blood to the heart, while coronary sinus bring deoxygenated blood from heart and pour into right atrium for oxygenasis. Questions number 26. The number of papillaris muscles present in right ventricle is options A 2, options B 3, options C 4, options D 5. The right answer is options B, that is 3. Number of papillary muscles which is present in right ventricle is 3, while in left ventricle it is present in 2. Okay, papillary muscles are the muscles which is located in the ventricle of a heart. It is attached to the cusp of the atrioventricular bulb known as mitral and tricuspid bulb via chordae tendineae, and it's contract to prevent inversions or prolapse of this valves on systole, ventricular contractions. Okay. Questions number 27. Two anterior vena cava are seen in options A, dog, options B, cow, options C, fowl, options D, horse. The right answer is options C, that is a fowl. Vena cava actually receive deoxygenated blood from different part of the body via different vein and pour it into right atrium. Normally, superior vena cava receive deoxygenated blood from upper part of the body of heart, while inferior vena cava bring deoxygenated blood from the lower part of the body, while fowl has two anterior vena cava. Okay. Questions number 28. The following artery does not arise from thoracic aorta. Options A, bronchial. Options B, esophageal. Option C, vertebral. Options D, seventh intercostal. The right answer is option C, that is a vertebral. Okay. The artery does not arise from thoracic aorta, that is vertebral artery. The aorta actually arises from that base of that left ventricles, having three parts, that is ascending aorta, and there is an arc of aorta, and there is a descending aorta. Ascending aorta give two branches, that is left and right carotid artery. Arch of aorta give three branches, that is brachiocephalic trunks, left common carotid artery, which give rise to internal and external carotid artery, left subclavian artery. Further, brachiocephalic trunks gives to right common carotid artery, which also further gives internal and external carotid artery, and right subclavian artery. Okay. Descending aorta has also three parts. There's a thoracic part, abdominal part, and terminal part, which form two branches of common iliac artery. And if we see that's artery which is arises from thoracic aorta, that is bronchials, esophageal, intercostals, and phrenic, while arteries which arises from abdominal aorta, that is celiac, phrenic, splenic, left ruminal, hepatic, left gastric artery, extra. Questions number 29. Os phrenic is visceral bone which is present in options A, dog, options B, camel, option C, bird, options D, pig. The right answer is options B, that is a camel. Os phrenic is a visceral bone which is mainly present in diaphragm of camel, while os penis is visceral bone which is present in penis of dog. Os cardis is the visceral bone which is present in heart of cattle. Os opticus is a visceral bone which is present in eye of fowls. Okay. Questions number 13. The largest venous trunks in the body is option A, posterior vena cava, options B, vena hemazygos, option C, anterior vena cava, options D, portal vein. The right answer is option C, that is posterior vena cava. The largest venous trunks in the body, that is posterior vena cava. Posterior vena cava receive deoxygenated blood from the posterior part of the body and pour into right atrium. Anterior vena cava receive deoxygenated blood from the anterior part of the body and pour into right atrium. Portal vein is a blood vessels that carry blood from the GI tract, gallbladder, pancreas, and spleen to the liver, while vena azygos is a single vein that drain blood from that dorsal wall of the left side of the thoracic and abdominal cavity and opens independently to the heart. Okay, this much for today. Thank you.